Dee, so good to see you.
It's so nice to see you.
I'm so excited.
Oh, let's get started.
Oh, the day has finally come.
I know.
What some people don't know about me is that I've always been super conscious of my teeth. I stick my tongue out in photos to cover my smile, and I always stifle a laugh so my teeth aren't visible. So when I finally decided to do something about it, I began a reconstructive process that's taken 4 long years.
The main problem was he is struggling with a really deep bite. What it means is his lower jaw is closing, over-closing, which is a self-destructive bite which starts hitting against each other and traumatizing the bone and gum.
The long-term implications were devastating to hear. Here I was, hoping that some glossy veneers over my crooked teeth would be the answer. But according to Dr Dee there was no quick fix. I was in it for the long haul.
He needed to get some extraction by a maxillofacial surgeon. He's needed to get his wisdom teeth taken out, and he had a leftover baby tooth and an adult tooth that was stuck underneath. So I'm going to get you to rinse out, and then I'll go through with a floss and a bit of a drill to clean up.
Throw in some serious teeth grinding, and getting that perfect smile was going to take patience, some pain, and faith in the man who was going to help me get it.
Cosmetic dentistry is such a superficial word, but it involves restoring aesthetics, but also restoring function and reconstruction of lost teeth structure. This one's going to be a little bit sensitive.
Okay.
But my issues are minimal compared to what many people suffer with their teeth.
We've seen a condition where completely there was no enamel developed on someone. Enamel is a white part of your teeth where people have full-on yellow teeth so they're chalky, brittle, usually teased for not looking after the teeth. This is a condition where always misread as neglect, but it is a developmental condition. Occasionally, we come across a lot of birth defects like cleft lip palate, enamel hyperplasia, conditions where the teeth haven't developed fully, and we have major issues in terms of function, aesthetics, and self-confidence.
So impacted by the suffering of many of these patients from bullying, lack of confidence and shame, that 11 years ago, Dr Dee set up the Bring Back a Smile Foundation.
Bring Back a Smile Foundation is more a movement where we do pro bono work. And I shouldn't say pro bono because it gives us a lot of satisfaction. So I get something that's better than money. But it keeps our passion in it by giving my time, skills, and it's just not me. Now there are additional dentists, and we want this to be executed all through where dentists or other professionals to give time and skills to someone in need.
Dr Dee started as a one-man band, donating his time and skills to people born with genetic defects, cleft palate, facial and oral trauma, even victims of domestic violence, and all of them leave their mark.
Nancy went through 2 lots of cancer operations where one part of her bone and teeth of half a mouth of her palate was removed, which means she had one half teeth, the other half no bone, no teeth. So we sat and planned, designed a smile. So we put through all the treatments and temporaries first, and the raw emotion that was in the room is priceless. She just needed some kind of help to restore her confidence.
Nancy's life was changed, but so was Dr Dee's and everyone involved in her transformation.
When Nancy saw herself with restored teeth, that was just in the temporary, but her emotions were so high and the happiness was instantaneous. Her eyes were lit, tears dropping down, and like the whole room had moist eyes. I can only feel tears when I think about the moment because it is satisfying, not just Nancy, but I think it is rewarding for the profession and rewarding for the passion that I have. And I think a lot of people will relate to it when you do it. So, when you feel it from in, and when you stay in the moment, you feel it's quite intense. And yeah.
Dr Dee was born and raised in rural South India. He watched his father, a GP, treat the locals, taking very little money, but mostly no payment at all in return for his services. It seems his generosity of spirit runs in the family.
Anyone born with birth condition that has affected their teeth are done feel I should be charging them. I've had this skill and I'm living a comfortable life. The least that I could do is give my time and skills to someone. It means a lot. So they're just secured in place with the little gel.
So you can see, I'm in very good and caring hands. And after 4 years, I can't even put into words the difference my new smile has made to my sense of self. I have restored teeth and restored confidence. Thank you, Dr. Dee.
I couldn't be happier. Oh, I'm not going to be able to stop smiling. It's going to be awkward in sad moments of my life because I'll just want to smile.